Welcome, everyone, and thank you for joining us live for this month's Community Spotlight as we discuss mental health and particularly children's mental health. For those of you who don't know me, I am Cassandra Mcglone, and I am on the board of FountainHead, Rhode Island. I am thrilled to be joined here today by Dan Wall, former president of Bradley Hospital and senior vice president of Lifespan. Good morning, Dan. How are you?
Morning, I'm fine. How are you?
I'm doing very good. Thank you so much for taking the time to join me here today and to talk to our community about mental health and children's mental health in particular.
Thank you for having me.
Absolutely. I'd like to start off by maybe just providing some insight. So can you tell us a little bit about yourself and how long you were with Bradley Hospital?
So I was the CEO from 1993 until I retired 2 years ago. I came in as the finance director. Bradley was in the middle of some very difficult financial challenges, so it fit right into my history and my expertise. And I was promoted to CEO in 93, and I stayed until I retired. During that time, Bradley joined Lifespan, which is the local health system. And it's a very, very important move for Bradley to become part of a much larger system to help us through some difficult times that, happen for any organization, but certainly in the children's mental health field, we had our challenges financially at times. So the history of Bradley, I wanted to touch on because it's very unique. Bradley Hospital was started in 1931, so we just had our 90-year anniversary. But it came out of the will of George and Helen Bradley, who lived at the turn of the century. George was Alexander Graham Bell's business partner. They actually met at Harvard. So George was a very wealthy man. He and Helen had one child, Emma. But Emma was born healthy, developed encephalitis, and was left with permanent brain damage through an infection that was untreated because there were no antibiotics. So they literally searched the world for help for their only child, and there wasn't any. So they set a home up for Emma with 24-hour nursing care. And she died at the age of 27 in 1921, I believe. George had set up a will, and Helen had too. They were very similar, but not identical, that when all three had died, that their vast estate would be used to create a hospital. Well, at first it was called the Emma Pendleton Bradley Home, became a hospital in the 50s. And their intention was to use their money to help other children who were, quote, similarly afflicted, the words in the will. And so our founding was very unique. And even the opening of the hospital was interesting in that the stigma was alive in the area of mental health in general, but certainly so little was known about children's mental health that the residents of East Providence needed a little arm twisting and a little encouragement to accept and approve the building and operation of the hospital back in 1931. When it was founded, it was the country's first hospital for kids with psychiatric issues. And as we go through this, I really don't like to even use the word psychiatric because I think it has an implication that's it's a tough implication that a lot of people read things into. I think for children, it's mostly behavioral health issues. Which is a much better way, I think, to look at the field. So Bradley evolved over those many years to be, I think, arguably the most comprehensive children's mental health service in the country. We started as an inpatient program. Kids were there for long periods of time, years. They didn't really know what was going on with a lot of these kids back in the 30s and 40s. The behaviors were difficult to manage, and they, kept them safe at Bradley. They were schooled. There was a big school program. During that time, there was some interesting discoveries. There was a man named Charles Bradley, who was the grandnephew of the founder, George. And Benzedrine was used in those days for headaches. And he was prescribing Benzedrine to kids for headaches. And they found that over the course of time, their academics improved. So it became known as the arithmetic pill. Well, the arithmetic pill, Benzedrine, is now widely used for kids with ADHD. It is still the drug of choice. It's not often referred to as Benzedrine, but that's the underlying medication. It's called Ritalin in most places. So Bradley was the site of that accidental discovery. It was also the site of the first EEG ever done on a person, including adults. It's done by a man named Herbert Jasper, who was probably, I don't know if they used the word nerd in those days, but I'm sure he was a nerd.
And
And
for those in the audience who don't know what EEG is, can you please explain?
electroencephalogram. So it's a test that is done for people still today, basically the same technology, to understand the brain waves that are going on in an individual and see if that is a sign of some type of brain illness. So he discovered the EEGs. It was used widely. First one was done on a child. Actually, I think the first one was probably done on a staff member who was a volunteer. In this day and age, you'd never get away with that. So Bradley was the site of really the history of child psychiatry and the history of Bradley Hospital are very much aligned. There are a lot of people that came through there over many years who went on to have illustrious careers. It joined the Brown University Medical School sometime in the early 60s. It's still part of the medical school. It's the primary site for training for child psychiatrists and psychologists. We have one of the largest portfolios of research in the country right now for child psychiatry, researching everything from autism to bipolar disorders, to every conceivable illness that you can think of. I would venture a guess that Bradley has got a grant to be looking into that illness. A lot of work done on early childhood intervention, a lot of work done on trying to identify symptoms of young children that may be different. Parents know it's different, but they're not sure why it's different. And a lot of research being done to understand at a very early age what can be done to intervene. Big focus on family therapy. Every child obviously lives in some type of modern family.
So they'll see the entire family, not just the child, but the whole family?
Sure. And I think that, when you think about that, all of these kids are going back to be in that family. Most kids never see the inside of the hospital. I mean, they're not on inpatient units. They're not, severely ill and to where they can't function. Most of the kids we see are either in outpatient programs or partial programs where they're going home at night to a safe environment. There's residential programs where they're 24 hours a day, but they're supervised. So of the roughly 1,000 kids that are probably in treatment today at Bradley, 70 of them are on an inpatient unit. The rest are in partial programs, outpatient programs, residential programs. We have a very large special education school. So the key to understand child psychiatry is to understand what a continuum of care is. So that from an outpatient visit that might be once a month to somebody who's struggling with something that, just needs a little intervention, all the way up to someone who needs to be in a locked unit because they've either attempted suicide or they've attempted to hurt somebody and they need a safe locked unit for a short period of time. I mean, a week, 2 weeks, they're not there for long periods of time. They used to be there for long periods of time. But as these other levels of care developed, where they can be treated at a less restrictive environment, those are the key words in children's behavioral health, well, in all behavioral health, but the patient being treated in the least restrictive environment. So to understand Bradley, understand the continuum of care, that they go from an inpatient unit to maybe a residential program, maybe a partial program, maybe an outpatient, maybe they go directly home. I mean, many kids do go directly home. The key to going home is safety. It's all about being safe. And if the kids don't have a safe environment in which to go to, then social workers will help create that safe environment. We have outpatient programs where we go into the homes to make sure that safe environment is being maintained. So it's a very comprehensive group of programs that Bradley is, quite frankly, I think is the leader, and not only in the clinical side, but on the research side and on the training side. And so we are able to recruit people who come from the most prestigious medical schools because they want to be in a place that is, at the cutting edge, quite frankly. And we have no problem in recruiting, many different types of clinicians. The staff include child psychiatrists, child psychologists, registered nurses, psychiatric nurses, what we call milieu therapists, the staff that are with the kids 24 hours a day, helping them through the various issues that they're tackling. So it's a very comprehensive service, and Rhode Island is very lucky, I think, to have it. If you have a child with mental health issues, I don't think you can be in a better state. I mean, there are many states, including California, that have pockets in some very prestigious cities, have huge pockets of need for child mental health services, and they're trying to develop them. So for a small state, a family is in a good state right here if they have a need for children's mental health. Not only Bradley, but there are other outpatient mental health services. There's Hasbro Children's Hospital. There are independent practitioners. There's a lot of services available.
Absolutely. And it sounds like a lot of firsts have been accomplished at Bradley Hospital as well. We're very lucky.
And there's going to be more. We're doing some research right now on the genetic cause of autism, and people are finding some very interesting things out there in terms of which genes are responsible for the autistic diagnosis. And of course, the next question is, well, okay, fine, you found it, but what do you do about it now? So that's another story altogether.
Very timely. I believe we just passed Autism Awareness Month as well.
Yep.
That's fantastic.
Yep.
So, I have to bring it up. Well, I guess before we talk about the impact of COVID, can you say a little bit about, before at the beginning you mentioned you don't like saying the word psychology and how there can be a stigma associated to it. Can you talk a little bit about the stigma around mental illness, specifically with children? Are we making progress, or what else needs to be done?
So just to correct you, you said psychology. I don't like to use psychiatric.
Psychiatric. Yes, thank you.
Psychology. Well, I think we've come a long, long way, but I also think we have a long, long way to go. I mean, I think from where we started many years ago, stigma was very strong. I think the insurance companies did not help with the stigma because they separated out the medical benefits from the psychiatric benefits. There I go. And that created a two-class sort of system of coverage, and they didn't help. But that's changing in a positive way. There's been a lot of legislation to help that. Stigma. I can tell you a few stories. So one, I mean, I got many, many, many calls when I was a CEO at Bradley from friends who I hadn't seen in 20 years, or I met at a bar 10 years ago or 5 years ago. And they were trying to they would understand how do they access services. And they would often share with me that it took them a long time to make that phone call to me. They didn't know who else to call. And either because as parents, they weren't on the same page as to whether they needed to seek professional help for their kid, or for a variety of reasons, it was delayed. And I remember one call, a friend of mine said, well, I don't know what to do now. I said, well, you've already done it. He said, what do you mean? I said, you called me. You've already done it. You've already decided.
Taking the first step.
You've already done it. And of course, we always, connect them with a clinician who can work with the family around whatever the particular issue is. I mean, psychiatrists and psychologists and social workers are really specializing now, like any other field. So there are some that, are more interested in seeing kids who are severely depressed. Some are interested in seeing kids who are highly anxious. Some are interested in seeing kids who have been bullied and are really getting afraid of going to school. A lot of phobias out there. So they're specializing. And I think that when people seek help for their child, they need to know, that one size does not fit all. And it's important to search for someone who is seen as a specialist in that field. So to answer your question, I think that stigma has come a long way in a positive sense. 20 years ago, when we would have a fundraiser, our annual gala, you were always looking for some family who would come to the event with or without their child and talk about their experience, because that's always a powerful motivator for raising money. Couldn't find anybody. We had a board member, I remember very vividly, who had a child that had been an inpatient, attempted suicide, was now out and back in school. And we were hoping that they would come to the event and talk about their experience. And he said, sure, I'll ask him, meaning his son. And the son said, no, I'm going to school now. It's behind me. I'm doing fine, but I don't want any part of.
There's a fear or a pushback because of the stigma around it.
Friends to know there's a stigma around it. Now, when we have our annual gala, we got more families than we can deal with who want to come and tell their story. And they want to bring their kid, and they want to have a table, and they want to talk to the other parents, and they want their kids to hopefully meet other kids. So, that's not mean that the stigma has gone away, but I think that is what's happening in terms of the trends out there, is I think that families they want to tell the story because they want other families, this is a big motivator for them, to not hesitate to seek help, because they know that they hesitated, and they didn't hesitate too long, hopefully, in most cases. But a lot of kids, it's difficult. I mean, it's difficult to make that first phone call and have to decide that you need professional intervention to help your child through whatever crisis they're going through. So I think we've come a long way, but we've got a long way to go.
Absolutely. It's so great to hear, though, that more and more people are being more outspoken, and hopefully that motivates others to take that first step, like you say.
And it's all over the media. I mean, it's all over Hollywood. People are coming out all the time talking about their issues, and I think that's a good thing.
It's actually funny that you mentioned media, because I just wanted to ask you specifically about social media. What is your opinion of social media and its impact on mental health of the youth?
So I'm not going to give you my opinion, but I am going to give you the opinion of about 20 other psychiatrists, psychologists, social workers. And
Sounds great.
when they're asked that question, and oftentimes in large groups, they will do this: raise your cell phone. They will say, that is a big problem. That is full-time employment for me, because what's going on in that social media world, while obviously there's a lot of upside to it, it's also creating a lot of peer pressure. Kids want to be somebody else. If they're not happy with who they are, want to be somebody else. Bullying is very, very alive, and unfortunately, and very dangerous for a lot of kids. Risk-taking behavior, it's all out there. Whatever you're interested in, if you just want to, cross that bridge and get involved in that risk-taking behavior, it's all there for the taking. Secrecy from their parents. They're on their phone. It's at night. They're on the internet. A lot of parents, one of the first things they say is, I don't know what my kid's into. I don't know what they're doing online. And when they take that phone away, I mean, that's a big problem. That's a huge problem if they try to, stop that kind of, use of social media. So the answer from all the people I've ever spoken to is that with all the upside to it, there's huge downside to it. And I think we're just going to see more and more and more of that over time. And no one has an easy answer, because you can't take the phones away from these kids. They'll create even bigger problems. But the parents have to be aware of the sites they're on and the stuff they're doing. And secrecy, most of the parents I've talked to, they always talk about how, we just don't know what our kid was into. And then it starts surfacing in other ways, which lead to, professional help that's needed. So I think the general answer to the question is not good.
God, yes, see, it sounds very complex, and it definitely sounds like, although it can have its goods, it certainly has its bads as well that we need to be aware of.
Dangerous.
Absolutely. So I know I mentioned COVID before, and I did want to ask kind of a little bit more relative to COVID. It's obviously triggered much discussion about how we're all coping with the impact of the pandemic, right? In many cases, families and individuals are experiencing great stress, grief, anxiety, many different feelings, right? Heightening the need for mental health care. I know I've even had more and more conversations with people in my circle about this topic. Yet we really don't have a playbook on how to handle this, do we? Do you have some thoughts on how families and children can manage these difficult challenges?
Well, I mean, I think you said a lot of it in the opening, in the way you framed the question. I mean, it's additional stress, and additional stress always brings out, fragile issues that may have been covered up. I don't have any, great wisdom on how to handle it. I think other than the usual, issue of communication, parents have to be even more aware of what's going on with their kids in the social media world. They have to be aware the kids are, they're probably more lonely. I mean, there are kids who love other kids, and there are kids who are, more reclusive, and they have to be aware of the kids who are, who, because they haven't had contact with their friends, are maybe getting depressed. I mean, they're young. Their lives have only, if you 12 years old, you've only been around 11 years. They don't have a perspective in which to put this pandemic. I can tell you that the demand is just incredible right now. It has been incredible at all levels of care. Now, when you think of demand and you think of the need for children's mental health, you have to keep in mind that, for example, in Rhode Island, there's about 220,000 kids under the age of 18, 1 in 5. Okay, that's about the national number. And if we see 7,000, 8,000 kids in the course of a year, I mean, that's less than 5%. So the number of kids, the absolute number, it's not, while it's difficult because the capacity isn't always there to take care of them, the actual number of kids, is not, I don't think, super alarming. It's not like every other kid. It's not like every third kid. It's 1 in 5 kids are seeking some level of help. And so, most kids are doing okay, but there's a lot of kids who need to seek additional, and this just puts another stress on the families. I mean, when I think of what I've learned at Bradley over all these years, I think of the word safety. When we think of safety, we usually think of physical safety. They may be on a locked unit because they need to be safe, or they need to make sure that they're in a home at night that is safe for them. But we don't often think about what I call emotional safety. In other words, an environment in which they're living where they can express themselves to their parents or their siblings or their aunts and uncles and whatever, their extended family. Mm-hmm. They can express what's going on with them safely so that they're not judged, they're not ridiculed, they're not, shut off. And let's face it, I mean, I'm perhaps of a different generation than a lot of people on this call, but, people didn't want to talk about feelings and mental health issues, generation or two ago. And I'm sure there are some cultures who still don't want to do that. But a safe environment also means, emotional safety. So you can share what's going on. And a lack of that is, what I would hear from clinicians, that they're in an environment where they can't tell mom and dad what's going on without feeling like they're going to get, ignored. I don't mean, abuse or anything of that nature, but just not accepted. Like if they, had some physical ailment and, and they're having trouble walking because they sprained their knee, so that would be fine. We'll talk about our sprained knee, but we're not going to talk about some of these thoughts that I'm having because that's not going to get well received.
Right. It sounds like it ties back into the stigma, right?
Absolutely.
It sounds like the best thing that can be done is to just make sure you have that open, safe environment, like you were saying.
Yeah, no question. No question about it. It's easier said than done.
Absolutely. Now, when you and I first met, you brought up a term that I had never heard of before called mental hygiene. Mm-hmm. And I thought it was a very interesting term. And I would love for you to tell us more about what is mental hygiene and how can we practice it? Because it was very interesting.
Well, hold on one second.
Sure. No worries.
My phone was going off.
No worries.
One day of many years ago, I was reading some documents from the Rhode Island Mental Health Association, which apparently was one of the first mental health associations in the country. So Rhode Island has been at the forefront of mental illness for some time. And I was reading through and I saw this term, mental hygiene, which I had never seen anywhere. And the folks, who authored it, I mean, they basically had their act together. I mean, they were looking at hygiene relative to mental health, behavioral health, analogous to hygiene that we think about for our physical care. And when we hear the word hygiene, we think of our personal hygiene.
Right, brushing our teeth, taking a shower.
Making, being preventative in terms of taking care of our bodies so that we don't get an infection or, have to go get a root canal. But our culture, I still haven't heard the word outside of my conversation with you, quite frankly. It's not a word that's out there, at least that I've read. Maybe it is, but But I think it says a lot that, hygiene is to stay on top of things, when I think of hygiene that way. And so how do you stay on top of your mental health so it doesn't become something more dangerous? And I think that, there's a lot of tips out there in terms of rest and exercise and eating well and so on but I think the biggest one is, to me at least, is communication, being able to share with someone. Well, which again is maybe the upside of social media, that kids share with each other, feelings that they're having that maybe they didn't share a generation ago. So there is clearly that upside. But I think hygiene to me for mental health is feeling free to communicate, back to that emotional safety and not being afraid to talk about feelings that you're having that may turn into some negative behavior, some desires that you're having and some issues that you're having or whatever, and feel free to talk about them, understand them better so that you can stay on top of them. And so that's what I think of mental, we ought to, our culture should be thinking more, like when you go for a physical, this has changed a lot, but it's only in the last maybe 20 years. No one ever asked you about your mental health when you went for your annual physical. At least not my primary care doctors didn't. Maybe they figured I worked in mental health, so I must be okay. Well, that's not a good assumption either. But now they are. They're asking, about depression and anxiety and safety in the home. They're asking those things, which is good, But that's my take on mental hygiene, staying on top of things the best you can. But talking about it. I mean, I don't know. I doubt that school systems are talking about mental hygiene. I hope I'm wrong, but I doubt it. Should be.
It sounds like it ties in very much to, what you were talking about before about creating that safe environment where there can be open communication, right? In times of COVID, when we're all locked up in the house and there's added stress and anxiety, creating those safe environments to be able to communicate those feelings or those thoughts. And that seems to be a practice of mental hygiene, right? It seems to all revolve around open, safe communication. Is that correct?
Yeah, I would say so. I mean, I don't want to oversimplify, children's mental health, but I think it's very important that open communication exists in a sense of safety.
Oh, no, absolutely. I'm sure there's many other, complex factors to consider and things that one can do, but it's great to have that starting point, right? Saying communication is the first step. And so as long as you're making sure to create the safe environment for open communication, it's a step in the right direction, right?
Yeah, and and just to comment on parents, I mean, I think that it's understandable. All parents have their own history and their own belief system and perhaps their own biases. But I think that parents have an obligation to their kids, not just for their physical safety, but to let them know they can talk about whatever's on their mind without being stigmatized in some way. So that they bring up a topic that, oh, I don't think dad wants to hear about this, or I don't think mom wants to hear about this. Parents have to create an environment which is okay to hear of just about anything, and then go
Absolutely.
from there. And I'm sure there are families where that's very difficult to do.
Absolutely. I can only imagine.
Mm.
Well, thank you so much for sharing all this wonderful information. Is there anything else that you would like to share with our community before we wrap up here?
Well, I mean, I would say that, in general, um, feeling comfortable calling for help. I mean, I think that's the most important thing. It's parents can only do so much, and when they're not supportive, many are. I mean, the stigma is better. I mean, I don't want to mislead anyone here. I think that things are a lot better. There's a lot more discussion amongst parents and amongst kids, but there are still, I'm sure, kids out there who need to get some help and need to be supported to get some help, and that's what parents probably can just look, just check themselves. Are my kids ready to say the things that I may not want to hear? you know,
Absolutely. Like your friend who made that first phone call, right? Just take that first step.
that's right, yeah. But other than
Well,
that,
thank you so much.
oh, thank you for having me. Appreciate it.
No, it's been an absolute pleasure. I really appreciate you joining us today to talk about mental health and particularly children's mental health. Ties in very nicely because later this month, Thursday, May 27th, the Fountainhead, Rhode Island community is actually going to be hosting our first event of 2021 on the topic of self-care and mental health. So please feel free to join us, and everybody in our community, please feel free to join us as well. That is a free virtual event. And I would also like to just thank our sponsors, Cross Country Mortgage. Thank you so much again, Dan Wall. Appreciate your time, and I hope you have a great